Welcome to Sleep. This PowerPoint is going to focus on sleep, sleep habits, and obstructive sleep apnea. Sleep is a basic physiological need. It's necessary for our bodies and minds to function properly, and it's the state of rest our body goes through after being awake. During sleep, our bodies are in a decreased state of activity with altered consciousness. When we're awake, we're mentally and physically active and expending energy, but during sleep, our body tissues are restored, our body releases human growth hormone, our cognition is restored, and our body fixes itself. Sleep is regulated by the reticular activating system, or RAS system. Our brainstem sends inhibitory signals to our RAS system, which then causes serotonin to be released. Serotonin causes a decreased response to our sensory stimuli. The pineal gland secretes melatonin, which makes us feel less alert, and cortisol is inhibited, which is going to decrease our stress levels. Then we fall asleep. As our sleep cycle starts to end, serotonin and melatonin are gradually decreased, which allows us to wake up. Our sleep consists of stages. The first and most abundant stage of sleep is a non-rapid eye movement stage, the NREM. This stage actually consists of 4 substages. Stages 1 and 2 account for about 5 to 50% of our total sleep, and this type of sleep is a light sleep. Stages 3 and 4, which account for about 10% of our sleep, is our deep sleep stage. The second stage of sleep is the rapid eye movement stage, or REM. REM accounts for about 20 to 25% of a person's nightly sleep time. REM sleep is when our pulse, respiration rate, blood pressure, metabolic rate, and body temperature starts to decrease, while our skeletal muscle tone and deep tendon reflexes are depressed. During our sleep cycle, we pass consecutively through the 4 stages of NREM sleep, and then the pattern is reversed and we return from stage 4 to stage 3 to stage 2. But instead of entering stage 1 again, we enter REM sleep. Then we re-enter non-REM sleep at stage 2, and it moves on to stage 3 and stage 4, and we just follow this cycle throughout the night. There are many factors that affect our sleep. The first is being our developmental stage. Infants, children, and adolescents need several hours of sleep per day. Infants needing the most, while adolescents still need close to 10 hours of sleep a day, but they usually get less than what's needed. Adults need about 7 to 8 hours per night, and the elderly need about 7 to 9 hours per night. Elderly usually go to bed earlier, awaken earlier, and awaken on average of 6 times per night. Regardless of the developmental stage, people with better health tend to sleep better. Culture and lifestyle can affect sleep either positively or negatively. Sleep is not highly regarded in American culture, as there are too many other things that we need to do, like sports and school and work. Environmental factors like noise, temperature, animals in bed, all affect how well we sleep, as well as psychological stress. Stress decreases the amount of REM sleep we receive, and illnesses and medications can also affect our sleep, especially in the elderly who take many different medications for many different illnesses, and they have all kinds of side effects. One medication that's well known to affect sleep are diuretics. If taken too late in the day, the diuretics can make the person have to urinate all night long. Another, quote, medication that affects sleep is caffeine. If our bodies don't get enough sleep, there are many negative things that can happen. Neurologically, we get irritable, we have memory lapses, we have more stress, and we can have impaired judgment. Our heart gets affected and we can develop hypertension, and we're at higher risk of heart disease and stroke. We eat more because the lack of sleep causes lower levels of the hormone leptin, and that leptin tells our brain to stop eating, and we have higher levels of ghrelin, which tells our brain to eat. This puts us at a higher risk of type 2 diabetes and obesity. We also have a higher risk of injury and cancer. So sleep is pretty important for our bodies. Children who do not sleep enough may have their growth and development affected during very important times of bodily growth. The first sleep disorder we will discuss is insomnia. Insomnia is difficulty falling asleep, intermittent sleep, or difficulty staying asleep when the opportunity and conditions are right for sleep. Insomnia is a very common problem in America, affecting 30 to 35% of adults. Insomnia may become acute or chronic, and people who suffer from depression have a higher risk of chronic insomnia. Many times, insomnia is related to disruptions in our circadian rhythm, which is our body's normal sleep-wake pattern. This can occur from stress, work, caffeine, and medications, and our day-to-day activities. The best way to treat insomnia is relaxation techniques, lifestyle changes, and sleep hygiene, which we'll discuss later. It's best to avoid medications for sleep for acute insomnia, like taking antihistamines or NyQuil or whatever else people try to help them sleep at night. The second sleep disorder we're going to discuss is obstructive sleep apnea, or OSA. Obstructive sleep apnea is a common sleep disorder that typically occurs in middle-aged obese men, but can occur in any age or any gender. In easy terms, people with OSA, their muscles or structure of the oral cavity and throat relax during sleep, causing partially or completely blocked airways. This causes a lack of airflow through the nose and mouth that can last 10 to 30 seconds or longer, which causes their oxygen levels to drop. This causes the person to wake up or will move them back into a stage 2 of sleep from whatever level they were in. In medical terms, the relaxation of the muscles and structures cause the patient to become apneic or hypopneic at best. These apneic or hypopneic times causes the person to wake up over and over again, which makes their sleep quality very poor. In severe cases, hundreds of apneic episodes occur every hour, causing severe interference with deep sleep and may even cause death. If you have a person that tells you you can't die from sleep apnea, and they will absolutely try to tell you that, I want you to think of me. My dad died from sleep apnea when he was 53 years old. Because people with sleep apnea have poor sleep quality, they're going to have daytime sleepiness, fatigue, and they definitely may have a need to nap during the day. The best treatment for OSA is a CPAP machine, which is a little machine that they use either over their nose or over their mouth and nose, and it's going to continuously push air into that person's nose or mouth, forcing them to take a breath while they're asleep. Also, losing weight is going to help OSA tremendously. And we really want to try to get these patients to stay away from any medications that are going to help them sleep, because sleeping medications are going to make the apneic times more severe. And that's what happened with my dad. He took a Benadryl one night to help him sleep, and it made him completely stop breathing, and he never woke back up. If we have a person complaining of sleep issues, we need to do a sleep assessment. Part of the sleep assessment is asking them what's occurring, what they think could be causing it, like stress, what signs and symptoms they're having, like daytime sleepiness, fatigue, and we want to know how this is affecting their life. We want to know when the problem started and how often it occurs. We also want to know what treatments they've already tried and if those treatments help them. Then we want to have the patient keep a sleep diary. Every night they need to document what time they went to bed, what time they tried to fall asleep, and what time they think they actually fell asleep. We want them to document how many times they woke at night and what time they woke up. What time did they wake up for the day? In addition to what occurred around bedtime, we want to know what stressors or worries may have affected their sleep. We want to know what food or medications they took around bedtime, and we want to know their physical and mental activities, especially in the 2 to 3 hours before bed. There is also evidence-based sleep assessment tools that can be used, and the most common one I've seen is the Stop-Bang questionnaire that they use for obstructive sleep apnea and the Epworth Sleepiness Scale. There are some physical symptoms of sleep issues that we can either witness or people can report. As far as witnessing, either we'll see it while they're in the healthcare facility, or we can have them come overnight for a sleep study where we attach the patient to EEG monitors that monitor their brain. We monitor their oxygen and we monitor their carbon dioxide, and we do a video recording to get a scientific view of what's occurring during their sleep. As far as physical symptoms while they're sleeping, we can see restlessness where they toss and turn all night long. We can see them trying different sleep postures to get them in a comfortable position. We can see what things they do while they're sleeping. Like, do they talk? Do they walk? Are they eating? Are they sitting up? Are they jerking their arms and legs while they're asleep? And we can definitely see if they're snoring. Snoring is a very common symptom with obstructive sleep apnea. During their waking hours, we can assess their energy levels to see if they feel well rested, if they're awake and alert, or if they feel fatigued and drowsy. We can see the lack of sleep on their face, as evidenced by dark circles under their eyes, watery eyes, yawning, heavy eyelids. As far as behavior, people who are not getting enough sleep may be irritable. They may not be producing at work or school. They might be missing deadlines. They might be falling asleep during the day, and they may not be able to concentrate. So what can we do as nurses to help our patients sleep better? Actually, we can do a lot. First, we want to create or educate our patient to create a restful environment. This might include appropriate temperatures and ventilations in the room. People usually sleep better in cooler temperatures. We want to eliminate distracting noises. We want to have a comfortable bed and pillow and comfortable nighttime clothing. We want to create or educate them on creating a bedtime routine with a consistent bedtime and awakening time. So they're doing the same bath, shower, wash their face, brush their teeth routine every night, and they'll decide if they want to watch TV, read a book, or listen to music before bed. They may also want to decide if meditation or prayer will be part of their nighttime routine. Another thing that will help sleep is avoiding naps during the day or limiting a nap to just 20 to 30 minutes max. Avoiding excessive mental stimulation before bed will help with bedtime stress levels, as well as not exercising within 2 to 3 hours of bedtime, but they should definitely exercise every day. We want to avoid heavy meals, alcohol, and caffeine before bedtime, but a light snack of carbs or milk may help them fall asleep. Eye covers and earplugs or white noise may help reduce stimuli in the room, but some people can't sleep with anything in their ears or covering their eyes. Also, after 30 minutes of trying to fall asleep, the person should get out of bed and do quiet activity like reading, but not playing on their phones and not watching TV. Lastly, over-the-counter sleep aids like Benadryl, which is the active ingredient in most over-the-counter sleep aids, should be used only for a short period of time. Even the bottle says use it for short term. The best thing to do is to try the above sleep tricks, and if they don't work, they probably should go see their provider. If the sleep habits don't help and a physical cause for the sleep issues weren't found on a sleep study, like obstructive sleep apnea, the provider may order sleeping medications for the patient. Not every provider will do a sleep study before prescribing medications, as sleep studies need insurance approval, but know that if things worked the way they were supposed to work, sleep studies would come before starting medications. There are many types of sleeping medications the provider might try. The main classifications are muscle relaxants, benzodiazepines, non-benzodiazepine hypnotics, and antidepressants. The most common muscle relaxants used to help sleep are Flexeril, Baclofen, Scalaxin, Soma, and Xanaflex. Although these medications are really meant to be used for people with muscle spasms or muscular disorders, the major side effect of these medications is drowsiness, so they get used a lot for sleep, especially if pain is a factor in sleep issues. These medications are not without their risks. They can cause drowsiness, dizziness, nervousness, and may cause orthostatic blood pressure. These medications should not be taken with alcohol, opioids, some herbal medications, or in people with sleep apnea. Also, stay away from these medications in people with liver diseases or people over the age of 65. Benzodiazepines are commonly used to treat sleep as they reduce sleep latency and decrease the number of times a person wakes up during sleep. They also increase drowsiness and help with anxiety. The most commonly used benzodiazepines are Ativan, Klonopin, Restoril, and Valium. Unfortunately, these drugs have a high risk for dependence, meaning the person can become addicted to these medications. Symptoms include drowsiness, trouble concentrating, balance and coordination difficulty, memory lapses, and the inability to retain new information. These also should not be used in people with sleep apnea. The non-benzodiazepine hypnotics like Ambien, Lunesta, and Sonata are great choices for people who can't tolerate the side effects of benzodiazepines, especially the drowsiness. These medications act in similar areas of the brain, but not all of the same areas that benzodiazepines do, so that is why there's less drowsiness. They also have less risk of dependency. The major drawback of these medications is that they may not keep you asleep all night long, and the body becomes accustomed to them, so over time they don't work as well. There are some alternatives to the other medications, and these are antidepressants. They usually are used in people who have anxiety and mood issues that are keeping the person awake. However, some of these medications can actually cause insomnia, so they're not always the best choice for insomnia. Side effects from these medications can include hypertension, weight gain, dry mouth, and insomnia. And these medications include nortriptyline, trazodone, amitriptyline, and duloxetine. And this is the end of sleep.